Subscribe to our YouTube channel and press the bell icon to get the latest updates.
I'm with Shamika Ravi, noted economist, a senior fellow at Brookings Institution and a former member of the Prime Minister's Economic Advisory Council. Ms. Ravi, welcome to ThePrint.
Thank you, Jyoti.
The reason I'm here to talk to you is to ask you about the coronavirus outbreak that India is in the middle, the world is in the middle of this pandemic. India has now crossed 5,000 positive cases and about 140 odd deaths have taken place. We are in the second week of the lockdown. What do you make of the situation today?
Well, the situation is unfolding. It's very dynamic, Jyoti, and that's why it's very difficult to also predict what will be the situation 1 month from now. And which is why, much against a lot of the epi models in the beginning that we were talking about, let's say 2 months back or a month back, we started the exercise of really just looking at weekly trends.
Who's we? So first tell me who's we.
We is me with my co-author, Professor Mudit Kapoor from the Indian Statistical Institute.
Right.
And we started looking at the data across different countries and seeing what is the rate at which the actual progression is happening, rather than predicting where they will end up. Simply because, you know, the original models which we heard about or we started to look at, these epidemiological models are based on assumptions from the early stage in China, or in the Diamond Princess, the cruise ship, which was a very controlled environment, so it is, you know, it was possible for them to...
That was anchored off the coast of Yokohama, and then there were several Indians also who had to be brought back.
That's the one. But if you look at the Chinese, the parameters that were assumed to predict for China, those early models had predicted more than 1 million COVID cases.
You're talking about the Ramanan Lakshmi Narayan model?
That's the one. That's the one. That was one of the several that then followed. But just to give you a sense...
actually, because it was
very alarming.
Yeah.
Extremely alarming. But the reason...
about 500 or 600 million people out of India's, or more than that, perhaps 70% of India's population.
Yes, we had various sort of estimates of that, predictions of that. But the reason it's important to talk about those is the policy environment is also not static, right? Every country really is responding to this emergency. So even in the Chinese case, where the expectation was for 1 million patients, eventually they had about 85,000. Right?
But not so far away from 1 million.
No, well, so it was quite, I mean, they were assuming a lot higher in the early stages. But then what you subsequently observe is the numbers in most countries are way off the initial predictions. And that's mostly to emphasize that governments are doing everything that they can within their limited government capacity, or in some cases, exceptional government capacity, such as Japan, let's say South Korea, or even Singapore. And now we know that after several weeks of what we thought was flattening and success, that in Japan, as of the last 5 days, we've seen the mortality rate, the COVID mortality rate has actually shot up. So Japan has finally declared an emergency. Singapore has actually now enforced a 1-month lockdown after the early success. So you see, we really don't know how this is going to pan out.
How this virus is going to take over people, nations,
spaces. So infection is spreading. I think we're all trying our best to contain it, but it is spreading. And since it is spreading, it's also important to then look at the day-to-day or the weekly averages and how things are moving, rather than, you know, make a prediction for how things will be in let's say 6 months.
So tell me about India. When you say you're looking at weekly averages, the Prime Minister announced on the 22nd of March, he said that when he announced the Janta curfew, then 2 days later, the lockdown was announced. We're now at the end of the second week. How do you see these last 2 or 3 weeks?
Well, I think it was very important. I mean, it was absolutely the right thing to do if you keep in mind that we are a resource-poor economy. I think many times when we compare our policies and the responses, or even the way people generally respond to certain policies, most of our comparisons are with the OECD countries, Jyoti, and I think at many levels that can be so misleading.
Which are the richer Western world nations in Europe and in the US, of course.
Absolutely, and those are resource rich and with incredible state capacity as well. So for a resource poor country, and particularly the healthcare sector, where the infrastructure is very lacking, and we've heard about numbers like how many beds per 1,000 people, how many doctors. We have half the number of doctors that WHO thinks is a normal society should have. Given these big shortages, a lockdown was perhaps the only preventive step that needed to be taken, and I'm glad the government did take this step. Now, the compliance, of course, has been almost complete, but many weeks before the lockdown, there was free flow, right? People were moving about, and it's only when every new day unfolds that we discover whether there is a super spreader in one place and what's the extent of the spread from those super spreaders. But again, if you just start to look at the trends itself, you know, before the 23rd of March, we were doubling every 3 days.
Okay, doubling the number of cases.
Doubling the total number of confirmed cases. And after the 23rd, we really did begin to slow down. And we maintained that slowdown for almost 2 weeks. And really the credit for that slowdown, the initial flattening of the curve that people are now familiar with, happened because, you know, India perhaps was the first country which completely stopped air travel from China.
Right.
It also stopped air travel from Iran and most of the European nations. We also airlifted people and kept them in camps, unlike elsewhere, where when people came back from China because travel was not restricted, people went back to life as normal in all these countries.
Right.
And therefore the infection spread very fast. In our case, these camps and the quarantines were effective to the extent of it limited the speed of the spread, right? So that's what you see around the 23rd of March. But then, of course, 29th of March, the whole Tablighi
Jamaat case in Nizamuddin happened.
Right, and now we know that more than 14 states, and it's an unfolding number, but as of at least few days back, we knew that 14 states had recorded people who were part of the congregation, and therefore now community spread or the contact tracing that is being carried out is of a very large number. We have 25,000 odd people who came into contact with the Tablighis and are therefore now being watched and traced and so on and so forth. So the scale of the problem and the complexity and the fact that it's a real-time dynamic problem just makes it a very intractable one as well. So you really have to read tea leaves in many ways. And so keeping a daily or a weekly check on how the numbers are going to then predict how the next few weeks will be is a far more reasonable way, I think, of looking at this, rather than, talking about hundreds of millions.
So you're saying that in the initial days, in the first few days after the lockdown, the numbers were doubling every 3 days.
Correct.
Which is good?
Which was right, but obviously not good. We want to slow it down.
Sure. So what about today? Now, 10 days after the Tablighi Jamaat sort of fiasco unfolded.
So we were doubling every 3 days, and then we started, because we slowed down, we were doubling every 5 days. So there was considerable slow down. But then after 29th, once the Tablighi numbers began to come up, we have remained around 4.
Okay.
So we are doubling every 4 days right now.
Right.
Which is still remarkably good compared to if you look at the US or the European countries, where despite having large numbers, the growth still remains pretty high.
And in one of your graphs, that's what you refer to as the Plato.
Well, the Plato has started happening now.
What does
Jyoti.
that mean?
Instead of looking at daily numbers and trying to make too much sense out of it, because there's so much that goes into the aggregation exercise. And again, remember, testing is the white elephant in the room, right? You're only as well informed as the number of tests and the places where you're doing those tests.
Now, ICMR is saying that they've tested as of the 7th of April.
Do you want me to finish that moving average bit?
I'm so sorry. Yeah.
So instead of tracking the day-to-day numbers, it makes sense to statistically think of 5 days moving averages. And we therefore started looking at 5 days moving median, because median is also an average.
Right.
We started looking at that, and that trend has begun to show a certain plateauing, which we are really hopeful that we have turned the corner as far as the growth rate of the contagion is concerned.
So if that plateaus, if the growth rate of the contagion plateaus, then obviously we can all breathe a sigh of relief.
Absolutely.
Or at least half a sigh.
If it stays on, that plateauing is long enough.
And how long has it been, this plateau? How long have you seen it?
Very recent. It's really just a couple of days.
So
there is reason to believe, therefore, that this is now finally the effect of the lockdown. Because the nature of the virus is, it takes 10 days to 2 weeks of incubation period for the symptoms to show up. So now if we begin to see the plateauing, you can take it back to 14 days. That is when the lockdown started. But this couple of days is not going to cut it. We need to see this consistently over the next few days. Now, here is where...
So how many more days? Do you want another couple of weeks or 2 weeks?
Well, we are watching day to day, Jyoti, but remember, again, it's a very fluid situation, right? Because we are also now testing a lot more.
Yeah.
We are also not testing randomly. We are testing in hotspots, which is why I say we are chasing the fire right now. So, because...
As of 7th of April, sorry to interrupt.
Yes.
The ICMR says there are 22 hotspots and they have tested over 1 lakh samples.
Right.
So, what does that show to you?
Well, it shows to me that it's like trying to find the needle where the light is, right? And of course we will find the needle where the light is, and that is why when we are putting more light, we are finding more cases, but we still need to keep ramping up that number, Jyoti, because and I'm not just putting out rhetoric in the form of we need to keep testing, aggressive testing, we need to do 3 things, test as the WHO said. It's important to know that because we are in a lockdown and the opportunity cost of an economic lockdown is very high for a poor country like India. So we have to know where to lift the lockdown. And if it has to be geographic, we also have to know when we say that it does not exist in a certain district, that it indeed does not exist there. And we're not in a position to do that until we carry out some more tests and random tests in those places. But to have a strategy or a protocol in testing which says that now we will begin a nationwide stratified random sampling to get a district level estimate to know that the contagion has indeed not touched these districts. We need to do that level of exercise, which means
we haven't done that so far.
We haven't done that so far. So we are talking about conducting at least 5 lakh tests across the country.
The government is talking.
No, I'm saying that
okay,
we should do 5 lakh tests, and we're not close to that number yet. But I'm hoping that the strategy or the protocol for testing will move into random sampling very soon.
So if you do 5 lakh tests, that will give you some idea of how the contagion is spreading or unfolding?
You know, the reason I say 5 lakh is because the country conducted the National Family Health Survey a few years back, and that was the largest representative district level survey done where biomarkers of people were measured. So we got to know at a district level
a biomarker?
How many people have hypertension, how many people have diabetes, right? And that requires a certain test and it requires an intervention. So I'm assuming that if we have the capacity, given that we held a massive survey like the NFHS, and the sample there was 5.7 lakhs. And that sample was large enough to give us district level estimate for these biomarkers. So I'm assuming that we have that state capacity. If we did a sample similar to that, we would get district level estimates of the infection itself.
So once you have these 5 lakh tests or about 5 lakh, then you can take a call on how you end the lockdown in a phased way, or what do you think?
Well, I think given the way we are moving, and again the state capacity, I think waiting for a large survey, the NFHS took months, Jyoti.
Exactly.
Right? So I don't think we can afford to stay for months till a survey of this nature or testing of this nature is conducted. I think we will really have to improvise and play along. And that's why I think currently putting more focus on the hotspots might have served us well in the first 2 stages. But I think preparing for the 3rd stage with an assumption that community spread has started requires us to now considerably ramp up our testing capacity. And testing capacity, by the way, is much more than just procuring kits.
Sure.
Right? It requires the refrigeration, it requires manpower, transportation. Many of our states, it takes several hours to reach the center from the collection point.
Right.
So keeping in mind all of these means that we have to prepare. And we cannot wait for a random sample of that nature to happen before the lockdown is moved, which is where we now start talking about calibrated lifting of the lockdown.
What does that mean?
Which means that, well, currently we know that majority, about 80% of the cases are restricted to about 60 districts of the country, and those are the hotspots and the other places where
60.
So if we are we know that those are we know that those are the areas we don't want to lift the lockdown right now. But if we have not heard of cases elsewhere, even without testing, and of course testing must happen,
Right.
but even without testing, because the entire state machinery at all levels, center, state, local, everyone is right now only doing this. We are all really waiting. Everyone is watching out for symptoms, and then certain tests happen. But otherwise, even before that, screening exercise starts quite early on, and the isolation and the quarantine. Just based on that, we know that there are many parts of the country which seem unaffected.
Okay.
So calibration would mean that perhaps in those places we can lift the lockdown. There was massive reverse exodus happening. Now, amongst the migrant workers, we're not yet sure how many of them were infected and what was the nature of the community spread through migrant workers. There have been, I have heard of one case, and that too it is not government reported, so I will discount that for the time being.
Right.
India isn't as mobile as we think it to be. Okay, and that, though it's a terrible thing from the economy perspective, from containing the outbreak itself, perhaps it's a good thing right now. So we've heard of the Bhilwara model, right? Everyone's really just confined into that geographic location. We will have to bring about such those kind of stringent measures of containment.
So you do feel that a phased lockdown could be, that a phased lifting could take place?
Phased lifting has to take place.
Why?
We're too poor. And it's very important to understand that people die of many reasons. COVID is one of them, and that's what we are watching, and we are very fearful because there's no vaccine for it. There is something called all-cause mortality, right? I mean, people will die of malnutrition. People will die of other kinds of necessities. I mean, we know that dialysis is not happening. There are many things not happening.
Right.
Because right now healthcare, I mean, all our focus and our efforts are towards containing and treating patients of COVID.
Right.
But we need to go back to life as normal and usual for all those parts of the country which remain unaffected.
How is this sort of economically, how is it going to affect India?
For people who think this is a pause, it's important to clarify that this is going to be a structural resetting of the economy.
What does that mean? Which
means it's not like when the lockdown is lifted, life will go back to normal. People will be afraid to go back to work. And particularly if you're talking about cross-state migration, right? It is most people who moved away, they moved away from Delhi and Gujarat and Maharashtra, Karnataka to UP, Bihar, West Bengal. Now, for those people to come back to the factory floor or the shop floor is going to take a lot more than just lifting of lockdown. So, if you look at the entire chain, the supply chain in the market or in the economy, the entire supply chain is disrupted. Now, it has profound implications for the economy as a whole. And we know it's an opportunity cost, it's ticking in terms of just the amount of value that we are losing on a day-to-day basis because of the lockdown. So when many people say this is really a trade-off between life and livelihood, it's real. It's absolutely real. But lots of lives are also lost when livelihood is lost. And I think it's very important to make that point up front.
Can you put a figure on this, on the loss that India will face in, after 6 weeks or a couple of months?
Well, we know that the France numbers came in this morning, and we know that they have had a reduction, 6% decline
of the GDP.
Of the GDP. So we saw a similar shrinking of the Chinese economy. Every economy
also
was shrink.
6%.
No, it was a smaller magnitude, but I always take Chinese data with a little bit of a salt because I'm not sure how comparable it is to the other countries. But naturally, we are going to be in a recession. We shouldn't fool ourselves that we are not. The entire economy has come to a grounding halt. Without any economic activity, there is no value creation. There will be no growth. Now, how much can you contain this? How do you prevent this recession from becoming a depression is the big question that I think most of us are grappling with.
And already the economy was slow because of demonetization and problems with the implementation of the GDP. So this is a double jeopardy?
Well, we were still growing at 4.5%. percent.
Right.
And this is when people compare this to the global financial crisis and say, look, 2009, this is nowhere close to that. This is multiple of that.
Multiple of the 2008 crisis.
Absolutely, because that was a financial crisis. This is a real economy crisis, like job loss.
But say, if you were to say April 14th, what figure would you put on the...
You mean if the lockdown for the last...
if the lockdown is lifted on the 14th?
For the entire economy?
Yes.
I'd say we'll be growing up at about 1.5–2%. But that's only 1 month of lockdown, right? But I'm also telling you that when we go back, when we think we can switch on the economy is not going to switch back on. People are not going to go back to their jobs. Right? You have many parts of the economy, and this is not just the MSMEs that are bleeding, your big businesses are also bleeding. Any business which has big fixed costs, like airlines, tourism, right? And has payroll, which has lots of people and lots of debt, they're all getting squeezed,
right?
Regardless of the size of the business. And it's unlikely that with the lift off, we will go back to life as normal. So that's why I say this is a structural resetting of the economy.
So my next question to you is about the 1.76 lakh crore relief package that the government put out. A, is that enough? And B, what is the strategy that the government should now implement?
Well, I think very appropriately, the first response was for people who live hand to mouth. And we have very many of those, right? Regardless of the growth. And we have pulled out hundreds of millions of people out of poverty, but many remain vulnerable, meaning simple shocks to income, and they fall right below. And that has impacts on health and well-being, children, etc. So the first set of announcements, the 1.7 lakh crore that you speak about, they were almost all entirely targeting this vulnerable group.
Right.
Therefore, the construction workers, the SHGs, the PDS, and all in good, those are exactly the right set of things to do. But first of all, now we also have to look at what is happening to the exact implementation. It's important to keep our ears on the ground as well.
Yeah.
Between the centre's announcement and a local government, not even state, a local administration actually performing those duties, so that this huge humanitarian crisis which is unfolding can also be contained along with the health outbreak, will require us to have this constant feedback. So that's number one. And number two, now we have to think of the rest of the economy as well. And that's where we haven't, other than the RBI policies.
Yeah.
We haven't heard from the finance ministry yet, and that's why I think we will hear very soon, addressing the concerns of the economy.
But what do you expect, and what do you think the finance ministry should do?
Well, I think very importantly, I think given the nature of the complexity of the problem, the simpler the policy solutions, the better they will be.
Like what? What do you think?
A tax holiday. We should waive all taxes for the next 6 months.
All taxes?
All taxes. And that simply would mean, less paperwork, no IT notices. The firms now know that they have this resource available to them to do what needs to do for the business to survive, right? And it requires less administrative capacity as well, right? So it's easier. It's difficult to do if you consider how palatable it will be for the administration. It's not going to be, nothing is palatable. But I think right now it works as a lifting of the tide, right? And there's no uncertainty there. People know exactly what is, there's no chartered accountant in the middle who has to break and count the bean and tell you exactly now how much do you get out of this announcement, right? So this is simple, and everyone is impacted.
The psychological relief as well.
And the psychology is a very large part of it, right? You're unlikely to see private investments, forget go up. CapEx right now, nobody's making capital expenditure investments right now because the future is so uncertain.
And besides the tax holiday, what do you think?
Besides the tax holiday, I think it's important to, of course, the details in terms of extending moratorium to NBFCs and all, very critical to maintain credit flow and liquidity to the MSME sector. But I think this is the time when we as a nation pledge a serious public health-driven investment strategy. It is amazing how little we spend on healthcare, and that little spending translates into almost non-existent public health infrastructure in a very large part of the country, right?
But health is a state subject. It's not a...
No, it is absolutely a state subject, but I think this is where the center can lead the way. The center has to lead the way because you have remarkable variations across the country, right? I mean, Maharashtra and Kerala have similar burden of the outbreak. They both have similar burden of the outbreak, but if you look at the mortality rate, then Kerala is very low. It's 1/6 of Maharashtra. And that's because they have, and Maharashtra, by the way, public health is not so bad. We're not even comparing UP Bihar style public health, right? And yet Kerala, with its strong public health infrastructure, has been able to curtail the impact of this outbreak, despite being very heavily burdened with the numbers itself.
So last couple of questions, Shamika. I noticed on your Twitter handle that you talked about varying data sources. I mean, some of your data you use from the Johns Hopkins Center, some from the ISI here in India. But there was also, you also talked about ICMR and how their protocols were very different.
You know, data has been one of our biggest constraints in this current crisis. We depend on the Johns Hopkins. In fact, right from the beginning, our analysis has been consistently using the Johns Hopkins data because their aggregation, and I think the data is more verifiable. It seems a little more credible than even the WHO data, frankly. So we have depended, therefore, on the Johns Hopkins. The reason I think it's important, there are lessons in such calamities for every institution, and ICMR I think has to learn not just from, of course, Johns Hopkins has the resources and people and so on, but I think ICMR can also learn from some of the states. Right? Maharashtra is doing a fantastic job of putting out data with a fixed protocol, so it also becomes easy for others to use it and provide timely feedback. Right? They put up PDF documents.
Yeah, I saw that on your Twitter handle.
They do things which make it impossible really to work with that data.
So last question is on this death rate per million in India, and how would you compare it to the rest of the world, especially the key hotspots today, US, Italy, France, the UK?
Oh, those are multiples of ours. And I frankly think that's the reason while everyone's working hard and everyone is very concerned, but that one ray of hope that I think collectively the public policy folks, or at least people watching the data, is there's no rush in the hospitals. If you look at the average trend of people coming in with acute respiratory disorders or problems, this year looks very similar to last year and the year before that.
Right now.
So the hospital level data is telling us that perhaps we haven't really faced the brunt of this outbreak the way the OECD, the European countries, or the US has faced. What the reasons for it could be, there are many right now. There's the BCG vaccine, humidity, temperature.
So you're saying that compared to the OECD, the Indian sort of data, or at least the information that you have right now, is still...
Oh, we're much better off, Jyoti. And I understand people's frustration when they say that, look, we aren't testing enough, so we don't know. And that is absolutely right. We aren't, and we should be testing a lot more for the confirmed cases and the active cases. But if you just look at the hospital rush and the mortality numbers, then, and it is increasing though, but it is far, far less than what these other hotspots are.
But you also talk about India being still in the growth phase of the outbreak.
Well, because the infection is growing. We are still doubling every 4 days. So it's important not to lose sight of that, that basic fact, and that this infection is likely to continue growing. And of course, the hope is that the innate ability and the immunity sort of keeps growing. But right now, what is a pandemic will eventually become endemic, right, to individuals' immunity and how human beings are going to respond to this.
Right.
The other issue is we don't have hospital or patient level data to really say whether this 80-15-5 break that you see amongst patients, that 80% patients don't really need any care, 15% will require some degree of hospitalization, and 5% will require ventilators or ICU support. Because we don't have electronic health records in India, that patient level information of how many of our people who were affected landed up in hospital, and of those how many had need for ventilators, unfortunately we're not in a position to say anything on that.
Shamika Ravi, thank you so much for this tutorial, shall I say, and explaining all these there's this jargon and the story as it unfolds. We will be watching you. We will be reading your Twitter handle, watching it very closely. Thank you so much for speaking to The Print.
Thank you, Jyoti.
This is Jyoti Malhotra for The Print. Please continue to watch our YouTube channel. It's live and buzzing.